Hello, I'm Paul Peterson, and welcome to Aging Well in LA. Today we're going to have a conversation with Dr. Scott Kaiser, whom many of you will recognize from previous segments, so we can talk about the use of the media in learning about healthy attitudes and aging practices. I think you'll find the conversation very interesting. Please stay tuned. Welcome back to Aging Well in LA. Today we're going to talk with Dr. Scott Kaiser. Scott, welcome so much to be here with us and have this conversation, because we have exciting news to impart. Dr. Kaiser is on a grant to produce many segments for Aging Well in LA and other media to help reach our senior population. Can you explain a little bit about what you're doing now and what the future holds?
Sure, absolutely. Yeah, it's a pleasure to be here. You know, normally I like being out there in the community, out in the senior center, so it's good to take a break and come into our office here and talk about what we're doing. We're working on something called Patient Empowerment Programming. Okay. You know, everything needs an acronym,
yeah, absolutely.
So we're PEP.
PEP.
Yeah, so we're working on a little PEP here, and the idea is that we want to get information out about aging and healthy aging, and we want to use media as a tool to do that. Right. You know, I'm a geriatrician, and I realized along the way that there aren't many of us. There are a lot more older people and a lot more older people coming down the line than there are geriatricians.
Right.
So I want to get some of the knowledge that we've built up with the excellent research. There's a number of evidence-based practices out there and resources. Great. So I want to get the word out.
Well, now you are a young man, and I'm always asked this question because it amazes me that a young professional can choose the field of aging, geriatrics. Tell me a little bit about your personal story, how you became sensitive to the issues of seniors.
Sure. You had to ask the long story first.
Of course.
We're going to take us totally off track here.
Well, but we have time, and I think people should know that the folks who care for them usually come to them with a true heart, that the compassion is genuine.
Yeah, well, let me start with where I am now with it, is that, first of all, I cannot be happier with the field that I've picked. I mean, it's exciting, it's dynamic, it has a humanistic element that's important to me. It's the kind of work that I'm glad to get up and go do every day. It's exactly where I want to be in medicine. So how I got here was a perfect storm, confluence of things. I always thought, I remember when I was finishing med school, I was looking around at residencies, I was asking around about geriatrics. Didn't really know a lot about it, but thought I might be interested. And then during residency, my first and second patient were elderly ladies who had complex issues that I just found were really interesting to deal with as a learning physician, mainly because they had a medical component, but there was a whole box of issues around that.
Right, the emotional and the social issues.
Right.
Yes.
So many of the problems weren't solved with the one pill or one treatment. It was really about modifying family factors and support and looking at the whole big picture.
Right.
So it had a holistic kind of piece. So then I had a senior resident and a faculty member who kind of took me under their wing in that field. Was able to do a great fellowship in geriatric medicine, which I just loved. And while I was starting to do that, my grandfather, who was a surgeon and an inspiration to me, he had Alzheimer's, and he started to really have some challenges.
Right.
And he had difficulty with hospitalizations, some confusion in the hospital, some difficult decisions as to what procedures to undertake, and just difficult decisions as to how to set up care for him. And in seeing that firsthand with somebody I love so much, I said, this is what I want to do. This is exactly where I want to be, and now I get to do that every day.
And it's a wonderful confluence because as a younger physician, you're more comfortable with technology than many practicing doctors, sad to say. And you've come up with this idea of using the technology instead of shying away from it.
Well, absolutely, because I'm just seeing the technology as a way to broaden the message and connect with people.
Mm-hmm.
I mean, the other part, there was a lot of stuff about my medical training, but simply, I mean, I like people, I like talking to people. That's a great part about geriatrics, is the great stories that you get. And I was really interested in using media to explore stories further.
Right, you were telling me earlier about the use of this new Wii or Xbot or whatever it is with like the bowling leagues.
Oh yeah, now that's a whole nother part there. Right. That's fantastic. I mean, it's amazing to think. Here we have, and I want to get in with the people using this at a variety of senior centers around LA. They're setting up these Xbox programs, where they have bowling leagues and dancing and tennis and all that. And I love to see, somebody might have what I would think is a little ageist thing and say, oh, they'll never do that. But I like to see people connecting, doing that, staying active, and it's just fun.
Well, and by using all the platforms available to us today, you can bring solid information too. It's not just about recreation. You can bring information about, say, some of the new technologies for helping with multiple medications, for example.
Absolutely. Couldn't agree with you more. Yeah. There's so much technology out there. That's another thing that I think we could do, is we could vet some of that as well.
Yes.
It's not all good. Some can have some downsides. Everything has advantages and disadvantages, so we want to look at those things carefully, because the marketplace is being flooded with these kind of technologies which offer great hope, but we also need to temper that by looking carefully at the evidence.
And I think we also have to have confidence in our seniors, the ones we care for, their ability to adapt to these new technologies. I know I went through this with my late mother-in-law. When she found out that she could get recipes from the Food Network, that drew her to the computer. It wasn't grandchildren's photos.
Right.
It was, oh, I can find new ways to cook. Well, there are new ways to find exercise programs or questions you might ask your doctor.
Absolutely. Health information is something we talk a lot about and plan to talk about on these segments, because we want to direct people to reliable sources of information.
Right.
There's misinformation and great information on the internet.
Right. Well, let's give our viewers an idea of exactly what Dr. Kaiser is doing for you. So this is now, it's called Patient Empowerment Program?
Yes.
Okay, PEP. Here's a sample of what we're up to.
Hello. I'm Dr. Scott Kaiser, board-certified family physician and specialist in geriatric medicine. Welcome to the Empowered Patient. We have a very special guest today, Fran Phillips. So now for our viewers at home, grab a pen, grab a pad of paper, because Fran's going to give us some great tips how to make the most out of your healthcare visit, not to be afraid to get a second opinion when you need it, knowing that you're the boss in what you need to do. So get that pen and get ready to write down some great tips from Fran here, and get the most out of your health. Tips that could help you live longer and better. How you doing, Fran?
Fine, thank you.
Nice to see you. Nice to see you. So tell me, Fran, what is it that you think seniors need to know about taking charge of their health and being more active in their health care?
Always go for a second opinion, sometimes a third. Some of my friends say, oh, you may hurt the doctor's feelings. Has nothing to do with it.
I hear that all the time. I mean, we're not talking about a car with some minor body work here. I mean, this is our health.
Well, I even go get car opinions on cars. So certainly I'm going to take care of myself and my husband.
Your health. Right. Tell us about that experience of getting a second opinion and even a third.
Well, Jerry went to a doctor and he said, you need another angioplasty on your leg. And Jerry went to his rheumatologist, and the rheumatologist called Jerry one night and said, I've called that doctor twice and hasn't returned my call. And he wanted to discuss the problem with the doctor suggested the angioplasty. And I went to see that doctor on Monday, and he said, well, what does he want to talk to me about? I said, well, why don't you call and find out? And I said to Jerry, we're not going to use this doctor. You don't have to go under anesthesia for nothing.
So when you found that this doctor was unresponsive, you were disappointed, and that brought up a red flag, that
Right.
this doctor wouldn't communicate with your other doctor, wasn't responsive.
Right.
So what did you do?
I asked who was the top vascular doctor in the city. I went to see him with Jerry, and he said, you do not need an operation.
So then you went to a second doctor, and this doctor had talked with your primary doctor, reviewed the records, went through all the information. Then you sat down together and were able to make an informed decision.
Yes, and they all agreed Jerry did not need an operation.
And you were insistent on getting a second opinion.
Right.
Absolutely.
You have to
Absolutely.
do that. And if you don't, you're making a very big mistake for yourself.
So, Fran, tell me, what did you get out of reading this booklet, Talking with Your Doctor?
You'll have to excuse me, but it comes with age. Summary: making decisions with your doctor. Ask about different treatments. Are there any risks associated with the treatment? How soon should treatment start? How long will it last? Are there other treatments available? How much will the treatment cost? Will my insurance cover it? Ask about prevention.
We have to think about prevention as an option. And
Right.
these are all ways that we can be more active in our own health care,
Right.
take charge of our health such that we can have better outcomes and really live longer and better.
Well, like exercise is very important. I walk up to 5 miles a day. And that has done a great deal for me because I have scoliosis. And the doctor said to me, who's known me all my life, said, I thought you would be in a wheelchair by now.
And Fran, thanks so much for bringing up exercise. We can't talk about that enough on this show. We're going to have to do future segments on physical activity. Absolutely, staying active is a critical part of healthy aging. Fran, thank you so much for joining us on The Empowered Patient.
It's
Always a pleasure.
Thank you, Dr. Kaiser. You're doing a wonderful job. And really, read this book, Talk with Your Doctor. It is so important for your health, and it is free. So make the call. It's important.
I'm empowered and I'm taking charge of my health.
Wasn't that terrific? Dr. Kaiser, that's wonderful. You're showing us how the media can be used. Thank you.
Thank you. Thank you. I mean, we're really, this is trying to be a team approach. We're doing it together, and that's why I really like getting out into the senior centers, getting out into the community, and I'm looking for people who want to participate in this project.
Oh, I'm so glad you're participating. Stay tuned. We'll be right back and continue this conversation with Dr. Scott Kaiser.
You know, I am getting better. I can still take care of myself. You just don't know.
No. 3 times a day. These drops.
Now that Mom's moved in, life has become a bit more complicated for all of us. We knew there would be challenges, but overall, we're glad to be together.
I don't like to call him from the office when I have to go to the doctor's or if I want to go out.
We're so thankful for the help we received.
Hey, buddy. I hope that's not what I think it is. Don't you know using fireworks can result in severe injuries, burns, or even death? Even sparklers can reach temperatures of 1,200 degrees. I wouldn't do that.
Hey, buddy! The ball call!
Attend a public fireworks show and leave fireworks to professionals.
One of the most dreaded conversations along the aging journey is when we have to talk about whether or not we can continue to live independently. This is a challenge for couples. It's a challenge for the individuals who have to face it. It's especially a challenge between middle-aged adults and their aging parents. What people most often do with this is one of 2 things. They either avoid it altogether and don't talk about it until it's a crisis, or they have very cranky conversations, or what we call a conversation gone bad, about the issue. It's so common that when we do workshops, we actually diagram this type of a conversation. And I want to share with you a little bit about this scenario. So this is a scenario. It's a diagram of a conversation. This is a mom talking down here, and I know you can't read it. I'm going to read some of it to you. And her daughter. And mom and dad are living at home. They're in their mid-80s, and they're about to lose their helper who's been coming in a couple of times a week for several years. And the daughter is quite concerned about this. So here's what happens. Maybe this is familiar. The daughter, Karen, walks in the door into Mom's kitchen after work and says, Mom, you know, Claudia's leaving on February 1st. You really need to do something about this. In fact, we have to figure out where we're going to move you and Dad. What? You got to be kidding me. We're not moving. We just need somebody else to come in a couple of days a week. We're fine. I don't think so. Dad's getting frail. You fell recently. Besides, he can't hear. And if you fell again and you yelled, he wouldn't even know that you need help. Mom, you're not safe here. We're moving you. Karen, honey, we've lived here for 40 years. We're not moving. Back off. But Mom, you are not safe. If you fall again, sweetie, don't you need to go make dinner for your family? This is a conversation gone bad and more common than we would like. And if we could continue to see what happens at the end of this scene, you would see Karen huffing out, angry as can be, and Mom with tears. So this is what we want to avoid having happen. The answer here, if we want to unlock any of these very difficult issues that are hard to talk about and we want to create a good conversation with somebody that we love, the first thing we have to do is attend to just that. How do I have a good conversation about the topic? One of the mistakes Karen made is she goes storming in there saying, Mom, you're moving. That's not the way to go. If both women can simply take a moment and recognize that this is a touchy topic, it's a scary topic. It's one that requires patience and respect and empathy and consideration. So, for example, here's another way this could have gone. Let's say Karen, she needs to go over to her mother's house and she wants to talk about this. And as she's driving over there, she says to herself, wow, you know, I kind of have a knot in my stomach about this and I'm feeling antsy. And I imagine Mom and Dad are kind of uncomfortable about this. If she just thinks those things and takes a deep breath, she might walk in the door and say something very different. For instance, she might say, Mom, you know, Claudia's leaving on February 1st, right? She's been with the family for 5 years now. How are you and Dad feeling about that? And if Karen can start the conversation like that, there will be a completely different response. There's the recognition that it's difficult. There's the recognition that it's frightening. There's the shift into a more loving place. And if Karen can pull this off, and if Mom can pull this off, even though it's difficult, they can experience having a relationship fulfilled one conversation at a time.
Welcome back to Aging Well in LA. I hope you are as excited as we are by having Dr. Scott Kaiser with us, bringing us new information and a fresh face. I'm excited about the potential going forward. Aren't you?
Oh, absolutely. I mean, I think we've been having such a fun time with this already. We've been getting out. We did a Talking with Your Doctor segment that many of the viewers might have seen. We did some segments promoting a booklet from the National Institute on Aging on physical activity and exercise.
Right.
So it's been fantastic.
Well, and it's wonderful they always say a picture is worth 1,000 words, and to be able to see a group of seniors actively engaged, doing healthy things, encourages those who may be sitting on the couch at home.
Well, you hit the nail on the head with what we're trying to progress into. I mean, what these segments are really supposed to be about is living longer and living better.
Yes.
We already know there are a lot more people living longer than ever. We're really trying to approach the question of how can we live better.
Yes.
And thanks to the generous support of the Hartford Foundation, we actually have an opportunity now where we really want to shoot some segments directly looking at physical activity and exercise in older adults, because that's an area where there's substantial evidence supporting the benefits in health and quality of life. So that's kind of my jargony look at it, you know, the health and quality of life of older adults.
But it's important. People have to understand that these things aren't just hatched on a rock someplace, that you have to work hard to get financial support. and then to interest the people who produce programs like this and others, that you need to pay attention to this growing senior population.
Right. It's a force to be reckoned with, and I think I want to be part of that movement to give a voice and empower this group, and I just want to be a part of that. And what I think with this physical activity and exercise programming, what we have an opportunity to do is approach it in a really fresh, new way.
Right.
I mean, I think that this can have a feel of some real motion and activity and be full of a charged emotion to really get people excited.
Well,
that's our challenge.
That is a challenge. But there are lots of ways to take shortcuts. For example, in most of the larger retirement homes that I've been to and visited, music has played an important role in either getting people up to dance, which wonderful activity, but to remind them that those memory cells still work. You can remember the lyrics. You can remember where you were when you saw Tommy Dorsey's band, for example. So I hope music is part of that.
Yeah, no, and we've had some touching moments already with song on the program, and hope to have more. And we would love to incorporate music and really have something that's really live for people, you know?
Have you ever noticed how many times you see a musician, world-class musician, you go, that person's 85 years old and they can still play that piano. How is that possible?
Yeah, you know, I mean, it's a complicated thing, but really, I mean, age is a number.
Yes.
And that's why, like, my specialty is looking at function and circumstance and goals. You know, so age is a number, you know, but let's look at how we can live better.
Scott, can you tell us about the UCLA fellowship program that you're involved with?
Oh, yeah, absolutely. I mean, right now I'm doing a health services primary care research fellowship at UCLA, and this is really what's given me the opportunity. My clinical care, taking care of patients is first and foremost to me. But to be able to take a little time to really see out this vision of using media as a tool to get information, to mobilize people around aging and healthy aging issues. So it's really thanks to their support that I'm able to take the time to really focus on this and do this in a quality way. I'm surrounded by people thinking about health policy and quality of care, and they're really informing this project, mentorship and that kind of support.
Well,
it's fantastic.
Thank you, UCLA. We have great resources in this city, and Hartford as well. I think it will be useful, too, to show caregivers and family members how they can encourage this process, identify perhaps an area of interest, and perhaps get in contact with you through the Department of Aging here in Los Angeles and say, look, what we did something positive.
Absolutely. I mean, this, you know, it takes a village.
Yes.
And you know, people say, oh, you're a young man. You know, aging is about everybody. We're all doing it, and it affects all of us, okay? So that's what we're trying to produce, content that everybody could enjoy and that could involve the whole family.
Right.
Because I don't think these things occur in isolation.
I agree with you.
That being said, we want to know people doing exciting things, particularly with these segments on physical activity and exercise.
Yes.
And that would be great if they could call in and tell us, and we could get out there and check it out and hopefully get them involved in guiding the process.
Well, I agree. And it's so important. If people have a new spark, they found a new kind of league or a social setting where seniors really thrive, they can contact you. Dr. Scott Kaiser at the Department of Aging right here in Los Angeles. The number's on your screen. And we do want to hear from you. So looking ahead with the technology, is this going to help lower the potential costs of an aging population?
You know, absolutely. I think there are a lot of things that can improve quality and be cost saving. Absolutely. That's not my area of expertise, but that's something that we'll always be conscious of. That's just a reality in healthcare and society. Healthcare costs have gotten out of control.
Oh boy, have
so
they.
There's no question that, you know, promoting health and fitness through physical activity and exercise can be cost saving, but that's really not the focus.
Right.
We're really about
quality,
you know, and hopefully somebody else can pick up that piece of the puzzle.
Right.
For now, we just want to work with what's already out there. I mean, we have evidence-based programs that already exist in LA to promote physical wellness, to get people moving. And so we just want to get people moving and keep them moving and, and do it together.
Well, we have had several shows about the danger of falls, for example, and how just simple fixes within the home can help prevent the beginning of the health problem for people.
Right.
Many times it's a broken hip, tripping over a cord that should have been tucked away.
Right. Once again, you hit the nail on the head because, as a geriatrician, I spent a large portion of my training was specifically dedicated to helping care for people who had hip fractures.
Right.
And the great news is there are treatments that are very effective, and the surgery is getting better and better, the surgical medical management during surgery. But that's something that's preventable.
Yes.
And you're right on the money because there are already evidence-based programs. There's Matter of Balance is available. It's in our city, and that's the kind of thing where we want to see who's offering that program, showcase it, get people involved. They teach you those things about how to modify your home environment, how to assess your own risk, how to strengthen to reduce your risk of fall. Right. And it's never too late to build more muscle.
Well, that's an important consideration. It is not too late. I am so excited that you were part of this program, and we'll be bringing important information to our viewers and the caregivers and family members who need to educate themselves as well. Dr. Scott Kaiser, thank you so much for coming in and sharing a bit of your background. It's important for people to know the Department of Aging is filled with people who, like Scott, are dedicated to the affairs of seniors. I've really enjoyed this visit, and we look forward to seeing you next time on Aging Well in LA.